What is Breo Ellipta inhaler used for? Breo Ellipta is used to treat asthma and chronic obstructive pulmonary disease, COPD. To use Breo Ellipta, you breathe it into your lungs through your mouth using the Ellipta inhaler. Asthma is when the muscles surrounding the smaller airways become tight, bronchoconstriction, swollen and irritated, inflammation. Symptoms come and go and include shortness of breath, wheezing, chest tightness and cough. COPD is a long-term condition that slowly gets worse. Symptoms include shortness of breath, cough, chest discomfort and coughing up mucus. Breo Ellipta has been shown to reduce flare-ups of COPD symptoms. Breo Ellipta contains two active ingredients, fluticasone furoate and vilanterol triphenatate. Fluticasone furoate belongs to a group of medicines called corticosteroids, often simply called steroids. Corticosteroids are used to reduce inflammation. They reduce the swelling and irritation in the small air passages in the lungs and can ease breathing problems. Corticosteroids also help to prevent attacks of asthma.